So delivering care that's not founded, or at least is found to be harmful, isn't the only way to do harm. How else might healthcare providers be doing harm?
So it's one of the points we make in the book is it's not just interventions or therapies or treatments. Sometimes diagnosing people can be harmful. This is a difficult concept to get across, and I've had discussions with people in the past. How can doing a test, not treating someone, just merely subjecting them to a scan or a blood test or something like that, how can that be harmful? Because surely that gives us more knowledge than we had before, and surely knowing more is a good thing. It's difficult to argue with this. I actually had a discussion on Twitter once with somebody who said the government should be paying for all of us to have a whole body scan every year or every 2 years, just to check for anything so that we can detect it early. And I had to say, no, that's a terrible idea, because you're going to find a whole lot of things, and those things might not necessarily have caused any problem whatsoever. But as soon as you know you've got them, you're a changed person. You're more worried. It might lead to treatment, which wasn't necessary, but has risks. And we use the example from South Korea from not very long ago, where they had a move to try and detect cancers, different cancers earlier, and they had certain screening programs. And one that the doctors thought was a good idea was to screen for thyroid cancer, and you can do that with an ultrasound. So it's not a harmful test. The test itself doesn't hurt you. It doesn't involve radiation or anything like that. It's just an ultrasound. So you can do this test and you can find very small thyroid tumors. So why not do this on everybody? So there was widespread screening for thyroid cancer. Now, what they found was lots of cancers, because there's a type of thyroid cancer which is very common. And if you open up the thyroid of people who have died, you will find this cancer a lot of the time. But this cancer very rarely ever goes on to kill you. So it's called a papillary carcinoma. So they started scanning people in South Korea, left, right, and center. And this was big business as well, you've got to remember. So the doctors' clinics were doing the scans. They were getting paid to do the scans.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.